Hey, I'm Ashley, I'm a pharmacist, and this video is for the writers and producers at the Pitt. Your show has been purported to be the most realistic depiction of what goes on in the emergency department, but you're missing one vital player of the interdisciplinary team. That player is pharmacists. A handful of pharmacists just wrote a letter that was published in the Journals of Emergency Medicine to the editors of the Pitt asking for emergency medicine pharmacist representation. If you haven't read it yet, this video is a little bit of a summary as to why that letter is so important. The role of pharmacists has evolved greatly over the last century, and you're seeing pharmacists now more than ever in settings like the hospital and more specifically the emergency department. When you think of a pharmacist, you think of the traditional dispensing pharmacist in a white coat at a pharmacy like Walgreens, filling pill bottles with medications. What's missing is how important we are in preventing medication errors and ensuring patient safety. Now we do this in a number of ways by evaluating drug-drug interactions, medication-related allergies, compliance and medication adherence, cost, medication appropriateness and optimization, not an inclusive list. In the emergency department, pharmacists are doing this at the bedside, often talking to patients before nurses or doctors even get to them. They are responsible for doing proactive medication reviews to ensure that treatments that are to follow are appropriate and safe. They're bedside at codes and traumas and rapid sequence intubations. We help drop medications at the bedside. We're aware of drug shortages and recalls and storage and availability concerns. Again, not an all-inclusive list. Some people seem to also forget that we were a pillar of strength during the COVID-19 pandemic. While everybody was inside trying to stay away from people, pharmacists still had to return to the workplace and fill prescriptions and give vaccines. And that was before we really knew what we were dealing with. What I'm getting at is that we matter, we are important, and we are an essential part of the interdisciplinary team. Now, can you operate an emergency room without a pharmacist? Of course, we have for a long time. But the point of healthcare and interdisciplinary teams is to make things more efficient and better and safer for the patient. And that is done by including pharmacists. So again, this is a call to the editors and producers and writers at the Pitt to include pharmacists in your screenplay. And also if you're hiring, I might be interested.